Imagine you give the wrong medication to the wrong patient. That small mistake can seriously harm the patient's life. That is why every nurse must understand safe drug administration. In today's video, we are going to look at 5 common drug administration mistakes student nurses make and how to avoid them. Before we talk about these 5 mistakes, let's first of all discuss just a little bit about the reasons drug administration really matters. Now, drug administration is one of the most important responsibilities in nursing because it directly affects patients' safety and recovery. Because if you think of it, the main reasons why patients come to our facility is so that we give them drugs and they get better. So, correct medication administration helps patients heal. It also helps prevent complications and reduces medication errors. Aside from that, remember, as students, we are exposed to OSC as well as clinical practice. So it also improves our performance during OSC. That is why drug administration really matters. As nurses, we are legally and professionally responsible for every medication we give. That is why safe drug administration should always be taken seriously. Okay, let's talk about these mistakes that we make as nurses, student nurses, and how we can avoid them. So, before I jump into these mistakes, let's quickly go through the 8 rights when it comes to the principles of drug administration. So when we talk about the 8 rights, we say the first right is right drug, right patient, right dose, right time, right route, right reason, right response, right documentation. Okay, so now let's talk about the mistakes. So the first mistake that students make is one, wrong patient. So the first common mistake is administering medication to the wrong patient. This usually happens when nurses fail to confirm patient's identity properly. So to prevent this mistake, always check the patient's name band. If the patient has no name band, ask the patient directly their name. If you are unable to speak, anyone on their bedside, or you check the files. In their files, the name is always found there. So make sure you get their full name and also confirm with the patient before you give any medication. Remember, right patient, right treatment. So that's the first wrong. The second wrong or the second mistake is wrong dose. So this may happen because of poor calculation. You know, as nurses, we must learn how to calculate drugs. So there is another video that you can go and watch right here on Smartness. We have talked about drug calculations, IV calculations, even blood administration, and many more. So wrong dose can happen due to poor calculations and also misreading prescriptions. So you know we have this situation in our wards where as a nurse you're not able to read or understand the doctor's prescription. Please, instead of trying to be a hero, ask around anyone who's able to help you understand or read clearly what the doctor has prescribed in order to avoid giving the wrong dose. Giving too much medication can also overdose, while too little may fail to treat the condition. So the dose should just be in the right amount. So to avoid this, always double check your calculation and confirm the prescription carefully. If you are not sure, ask your in charge, ask your colleague, ask anyone around who's able to help you. The third mistake is called poor hand hygiene. Poor hand hygiene. So poor hand hygiene, this is a third mistake. Some nurses forget to wash their hands before or after administering medications. This increases the risk of infection and cross-contamination. Proper hand hygiene is very important in protecting both the patient and the health care worker. So remember, always wash your hands before and after every procedure. The fourth one is failure to check expiry date or not checking expiry date. Expired drugs may become ineffective or even harmful to the patient. So before administering any medication, please, my fellow nurses, inspect the label carefully and also confirm with the expiry date. Safe nurses pay attention to these small details. In fact, they're not even small details, they are huge details. And then lastly, the fifth is failure to document. Remember, in nursing, we have a slogan that says, if it is not documented, then it was not done. So the fifth mistake is failure to document medication after you administer. So poor documentation can lead to double dosing, of which you are harming the patient. It can lead to confusion among health workers and also legal problems. So always remember to document immediately after administering medication and record the correct details. In nursing, we say if it is not documented, it is not done. Okay. So in conclusion, what I can say is most medication errors can be prevented when nurses follow the correct principles of drug administration. And just to run through quickly, we said right patient, right dose, proper hand hygiene, check expiry dates, and also proper documentation.